Hello, my name is Roelie Hempel. I'm one of the co-directors at Radically Open Limited and RO-DBT Online. And this webinar will be about an overview of published clinical studies on RO-DBT for eating disorders. So this is specifically about the research that has been carried out. And you may have seen the webinar RO-DBT for eating disorders, what clinicians need to know. But if you haven't seen it already, we really recommend you watch that as well. Okay, so let's get started. So the first study that was carried out was by Lynch, Professor Lynch and his colleagues in 2013. Radically open dialectical behavior therapy for adult anorexia nervosa, feasibility and outcomes from an inpatient program. In this study, 47 adults diagnosed with anorexia nervosa restricted type received RO-DBT inpatient treatment. The overall study dropout was 27%, which is so 13 people dropped out of the study. And just for comparison, the typical dropout rate in adults with chronic anorexia nervosa ranges from 13 to 66%. Now, 3 of those clients dropped out of RO-DBT specifically, and 9 clients declined further weight restoration, and they left the unit against medical advice. And 1 client chose to continue weight restoration as an outpatient. Of the treatment completers, 32 of the 34 were female. Their average age was 29.7, and the age ranged from 17 to 64. And almost a quarter of them had had previous inpatient admissions. And over 6% of these clients even had been admitted 4 or more times. The mean number of weeks of treatment that they received was 21.7, and this ranged from 3 to 53. And in comparison, the mean number of weeks of treatment for people who did not complete the treatment was on average 13.7, and this ranged from 4 to 25. Now, the only pre-treatment difference between the completers and the non-completer group was admission, BMI or body mass index, with those in the completer group having a significantly higher BMI than those in the non-completer group. So let's have a look and see what they found. They found significant and large effect size increases in body mass index using intent to treat analysis, which means for the whole group, regardless of whether someone completed the treatment or not. And when they only looked at completers, the effect size was even higher, 1.91, and this is considered very high. The body mass index of treatment completers at admission, their mean was 14.7, and this ranged from 12 to 17.8. And at discharge, the mean was 18.3, ranging from 15 to 23. And they also found large effect size improvement in eating disorder-related psychopathology and psychological distress with the treatment completers. And here is a graph where you can see the remission rates. 35% of patients were in full remission. 55 of the completers were in partial remission, and 10% were not in remission. But what this means is that the overall response rate to the treatment was 90%. So the main conclusions of this study: RO-DBT is a promising treatment for individuals suffering from anorexia nervosa restrictive type delivered in inpatient settings. And the intent to treat analysis demonstrated significant improvements in weight, general psychological distress and well-being, and quality of life, despite the fact that RO-DBT does not emphasize the importance of targeting eating disorder behaviors or weight gain. So, next study was carried out by Eunice Chen and her colleagues published in 2015, adapting dialectical behavior therapy for outpatient anorexia nervosa. And this was a pilot study, which we can also tell by a relatively small sample size. 9 adult female patients with anorexia nervosa took part, and the age ranged from 19 to 51. And at baseline, 3 of the clients had the restricted type, and 6 clients binge purge type of anorexia nervosa. 88% had at least one comorbid axis 1 DSM-4 disorder, such as depression. 63% had at least one comorbid axis 2 DSM-4 disorder, such as obsessive-compulsive personality disorder. 25% reported histories of suicidal or non-suicidal self-injury, and 7 out of 9 had made previous attempts at weight restoration, utilizing inpatient, intensive outpatient, partial hospitalization, and support groups. So a whole range of treatments that they've tried before. Now, for this study, the treatment consisted of standard individual DBT plus 8 weeks of radical openness skills classes. And the total amount of the months, or the mean of months that clients were in treatment was 8. And this ranged from 4 to 12 months. And the treatment dropout was 1. Only one person did not complete it. They were withdrawn prematurely due to medical instability and the need for inpatient treatment. So here's what they found. The intention to treat analysis showed significant increases in weight gain and menses resumption for 62% of the sample at the end of treatment. They also found large effect sizes for body mass index, and this was sustained at 6 months and 1 year follow-up. You can also see this in the graph that is shown on the slide. This is the orange line. So the mean BMI at admission was 18.7, ranging from 16.6 to 20.7, and the mean BMI at discharge was 19.7, and this ranged from 17.9 to 21.1. They also found medium effect sizes for improvements on eating disorder examination score, and this was sustained again at 6 months with a small effect size at 12 months. And this is shown with the yellow line in the graph on the slide. So the main conclusions, the results suggest adding skills addressing over-controlled emotions and behaviors to standard DBT may be helpful and are enduring, despite the fact that DBT and the skills addressing an over-controlled style do not focus on weight restoration. And the use of radical openness skills for weight-restored anorexia nervosa clients may be helpful for relapse prevention. So let's look at the next study. This was carried out by Bodinet et al. In 2020. This was published. Targeting maladaptive overcontrol with radically open dialectical behavior therapy in a day program for adolescents with restrictive eating disorders, an uncontrolled case series. Now, this was quite a large sample. 131 clients took part, all adolescents, of which 123 were female, and their mean age was 15, ranging from 11 to 18 years old. The primary diagnosis at assessment, it was, mostly predominantly anorexia nervosa, 93%, and mostly were the restrictive subtype, 83.8%, 4% was binge purge subtype, and 5% atypical anorexia nervosa. And then there was a group of 8 patients who were diagnosed with other specified feeding and eating disorder. Comorbidity for this group was the norm, with more than half predicted to have 1 or more comorbid diagnoses and almost 1/4 with 3 or more at assessment. Overcontrol was assessed using the Assessing Styles of Coping word pair checklist, which can be found in the RO-DBT treatment manual. And they used this to screen for overcontrol to make sure that the treatment was relevant to the client. And this was carried out at an intensive day treatment program where RO-DBT is the main group treatment model at Maudsley Hospital in the UK. And the group therapy program is spread over 6 hours and 15 minutes a week, of which 2.5 hours are dedicated to RO-DBT skills classes. And this was split over 2 sessions a week. And the RO-DBT skills class content was modified from Lynch's original skills manuals to be more adolescent appropriate. And it was offered over 16 sessions. And the content of the skills classes is repeated approximately every 8 weeks. And the remaining ITP group therapy content included cognitive behavioral therapy, cognitive remediation treatment, and art therapy. So, what did they find? Well, the mean length of stay in the intensive day treatment program was 13.4 weeks, ranging from 1 to 30 weeks. The mean percent median BMI at assessment was 18.4%, and this increased to a mean of 89.5% at discharge. At discharge, more than 70% of adolescents had a good or intermediate outcome using the Morgan-Russell Global Outcome Measure, and the remainder had a poor outcome. One had missing data and could not be categorized. 6 people required inpatient treatment during or after ITP. Eating disorder symptoms at assessment were significantly correlated with over-control factors, including social connectedness, reward responsivity, and cognitive inflexibility. Significant improvements in drive for thinness, depressive mood, social connectedness, and emotional expressiveness were reported at discharge. And so their main conclusions were that this exploratory study provides preliminary evidence that temperament, personality, and social factors related to overcontrol may be associated with restrictive eating disorder and related psychopathology in adolescents. And the results also indicate that an RO-DBT informed day program may lead to improvements in eating disorder symptoms and several factors associated with overcontrol. So, the fourth study, carried out by Isaacson and colleagues and published in 2021. Radically Open Dialectical Behavior Therapy for Anorexia Nervosa, a multiple baseline single case experimental design study across 13 cases. So all 13 participants were females, adults ranging from 18 to 45 years old. They had mild to moderate anorexia nervosa or atypical anorexia nervosa. Only patients with a BMI over 16 were included, and the mean BMI at admission was 17.5. The number of current comorbid diagnoses ranged from 1 to 3. And because RO-DBT is only relevant for patients with overcontrol tendencies, a patient's personality style was identified according to the prototype rating scale by Lynch. And again, this is in the textbook. The treatment, this was in an outpatient setting. The RO-DBT encompassed a 40-week full-scale intervention program, including individual therapy, skills training in class, telephone coaching when necessary, and weekly team consult meetings for the therapist. And as for all interventions treating patients with anorexia nervosa, support to target key elements of anorexia nervosa, such as being underweight or in starvation, was included. So this was done by medical professionals. So what did they find? 8 out of 13 patients were in full remission after treatment. 4 were in partial remission, and 1 had deteriorated. And 6 were still in full remission at follow-up. Among the completers, all 8 were in full remission after treatment, while 6 were in full remission at follow-up. Comparing the completers with the non-completers were generally older, had more severe symptoms before treatment, and had a longer duration of the eating disorder. This indicates that the sooner a person receives treatment, the more likely it is that they will be able to recover at least somewhat. Okay, the mean change in body mass index before versus after treatment was 1.7 kilograms for the whole group and 2 kilograms per square meter for completers. So the main conclusions: RO-DBT significantly, clinically, and reliably reduced eating disorder psychopathology, and the quality of life was improved, and impairment due to the eating disorder was reduced. So we're getting to the final clinical study by Bodinet et al., published in 2021, Radically Open Dialectical Behavior Therapy Adapted for Adolescents, a case series. In this study, 28 adolescents took part, of which 26 were female. Their mean age was 16 years, ranging from 13 to 18. There were high rates of major depressive disorder and eating disorders, both 78.6%, and comorbidity was the norm, with 86% meeting criteria for 2 or more DSM-5 psychiatric diagnoses. 23 adolescents reported eating concerns at assessment, and of these, 22 met DSM-5 criteria for an eating disorder diagnosis. All but one had an eating disorder primarily characterized by restrictive eating, so anorexia nervosa and atypical anorexia nervosa. The mean weight at the start of the RO for adolescents for the young people diagnosed with an eating disorder was 94.6% of medium BMI. And all adolescents had received at least one type of psychological treatment prior to attending RO for adolescents. The treatment itself was 20 weekly skills classes of 90 minutes, provided alongside weekly individual sessions of 60 minutes. Some of the original RO-DBT skills were simplified, combined, and/or the language was changed to be more adolescent appropriate. The structure and timing of the weekly individual sessions remain unchanged. So the results. The mean number of RO for adolescent sessions attended was 18 group-based skills classes and 21 individual sessions over a mean period of 34 weeks. Symptoms of depression reduced significantly from baseline to discharge with a large effect size. And those with eating disorder concerns at baseline reported a significant reduction in eating disorder symptoms with a large effect size. Significant improvements with medium and large effect sizes were reported in cognitive flexibility, risk aversion, increased reward processing, and reduced suppression of emotional expression. Adolescents also reported feeling less socially withdrawn, more connected to others, as well as more confident and comfortable in attachment relationships. Exploratory correlation analysis suggests improvements in overcontrol are moderately to strongly correlated with improvements in symptoms of depression and eating disorders. The main conclusion of this study is this case series provides preliminary evidence that RO for adolescents may be an effective new treatment for adolescents with overcontrol and moderate to severe mental health disorders like depression and eating disorders. And radically open dialectical behavior therapy for adolescents led to improved management of overcontrol, improved relationship quality, and reduced mental health symptoms. And now I want to talk to you one final study, which was not a clinical trial but a qualitative study, sharing and connecting with others, patient experiences of RO-DBT for anorexia nervosa and overcontrol. And this was done by Isaacson et al., published in 2021. 11 of the 13 patients who previously took part in the clinical study accepted an invitation to take part in a qualitative study. This is all 8 completers of that study and 3 out of 5 of the non-completers. They were all adult females with a mean age of 25, ranging from 18 to 41 years old, with mild to moderate anorexia nervosa or atypical anorexia nervosa. All 8 completers were in remission after treatment, with the BMI within a healthy range and eating disorder psychopathology within 1 standard deviation of the community mean. The non-completers were either in partial remission or not improved. So, the qualitative interview, a research assistant not involved in the treatment was contacted the patients via phone to provide information about the qualitative interview. Each patient who was willing to participate was booked for a face-to-face interview within a month from treatment termination. A semi-structured interview guide was developed to explore the patient's overall experiences of the treatment and began with an open question asking participants to describe their experiences. So, what did they find? Well, the main conclusion was that patients appreciated what they described as a comprehensive treatment and holistic view of their problems, which helped them reduce both maladaptive overcontrol and eating disorder symptoms. Gradually sharing personal experiences both in and outside therapy was described as essential and led to enhanced social connectedness. And what I would like to do next, share a couple of quotes from the paper, um, just as an illustration of what clients said. For example, there has been a lot of focus on feelings and relationships, which is very different from previous treatments. I've been to date programs several times, focusing only on eating, but that has not been therapy. And once I went to regular therapy with no focus on the food, which made me sink like a stone. This therapy has been a good balance. I was allowed to talk about food if I felt I have to talk about this and get a structure. It's been a very good combination. And another participant said, in the beginning, I felt like these questions are really uncomfortable. I don't want to do this. That's why I was skeptical in the beginning. I wanted solutions right away, like, this is what you should do. And if I do that, everything will be fine. I know it doesn't really work like that, but that's what I wanted. But looking back, it was really helpful. And finally, I've been able to let go of these thoughts about having a certain body and a certain weight. There are other things in life that are more important. There are days where I want to just go with the eating disorder, but then I remind myself there are friends and school and things that I enjoy doing. Yeah, it's really nice to have a life. And I really recommend reading this paper, well, all of them, but I found this paper particularly helpful in understanding the client's experiences of RO-DBT. Okay, so as with all studies, there are limitations and there may be risks involved, so I will summarize these here. The biggest limitation is that none of the reported studies were randomized controlled trials. And RO-DBT has not directly been compared with other psychological treatments for eating disorders. And that would be useful to see whether there are any differences or perhaps one treatment is more suitable for a specific client than another treatment. And also 4 out of 5 studies had small sample sizes ranging from 9 to 47 participants. And if you recall, only the study done by Bodinet had 131 participants. Still, all information helps, but larger groups usually preferable when it comes to scientific research. And as for risks, no risks or serious adverse events were reported in any of the published studies. Okay, and actually, the efficacy of RO-DBT has also been researched in depression, personality disorders, and autism. So if you want to know more, you can go to our website. We have a page where we list all the research papers to date on radicallyopen.net. So, to conclude, what are the take-home messages? Well, assessment for overcontrol is critical. Overcontrol is strength diagnostic and not limited to specific diagnosis or only one type of eating disorder. So it's important to assess on a case-by-case basis. The RO-DBT outpatient treatment model can be adjusted to accommodate various settings and age groups, as we have seen demonstrated by these studies. RO-DBT typically results in lower treatment dropout rates than commonly found in eating disorder treatment research with anorexia nervosa, which ranges from 13 to 66%. Medical monitoring and weight tracking should be carried out by medically trained professionals, not the RO-DBT therapist. And RO-DBT can be effective for clients who are underweight or have other severe eating disorder symptoms as long as they are medically stable and able to participate in individual sessions and skills classes. And an example is that there were clients with a body mass index as low as 12 in a study by Lynch et al. And also in other studies, we've seen clients have had multiple previous admissions, inpatient or outpatient. Comorbidity is very common, and suicide, ideation, or self-injury may also be quite common. So that's it, really. Thank you for listening. If you want to know more, we have lots of information on our website, radicallyopen.net, about the treatment itself, about research, and about training events. So, Thanks again, and we hope to see you at one of our trainings. Bye bye.